Hello, my name is Dr. Gene Accius. I am the Senior Vice President at AARP of our Global Thought Leadership function. I also lead our Disparities Enterprise Strategy, and we are in for a great conversation today. I'm extremely honored to be on this panel and to help moderate a conversation with three amazing trailblazing leaders. We have Dr. Jarrett, we have Dr. Ansari, and Dr. Davis. Over the last 18 months, it's fair to say that we have been through a whirlwind, both in terms of the pandemic, the fallout of the pandemic as it relates to the health disparities that we're constantly seeing, as well as the impact on out-of-pocket costs, particularly for communities of color. In addition to that, we are also seeing significant racial reckoning across the country and significant magnitudes. And while we are all facing these storms, it's very clear by the data, it's very clear by the impact, particularly when you look at infection rates, you look at hospitalizations, and you look at deaths, that we're frankly not in the same boat. I am extremely honored to kick off our conversation by introducing these three amazing leaders who's been doing amazing work across the country, but in particular in their communities, to really close these disparities gaps in a very meaningful, strategic, and intentional way. So buckle up. I hope you're ready for this powerful conversation. And I'm just going to kick it off. And I'm going to kick it off by just telling you a little bit about AARP, and particularly why would AARP be in this? AARP has been a tremendous partner with the Greater Cleveland Urban Film Festival for many, many years. And we believe in the power of storytelling. We believe in the power of elevating the stories, the perspective, the lived experiences of people, so we can really kind of understand not just what the challenges are, but also what are the opportunities to solve them collectively together. And for more than 60 years as an organization, we have been on the front lines working with key partners to really close the opportunity gaps, because we understand that the disparities that we see in old age, however you may define that, did not start once that person received that AARP card. That these are issues that have been long-standing, structure in nature, that frankly need to be solved with the same level of intentionality that is needed. And the three dynamic leaders that we have here on our panel today is going to really help demonstrate the opportunities that we have to really solve many of these disparities, particularly as it relates to health disparities. And given the fact that this is a film festival, and the power of storytelling, I want to really kick it off and give them the opportunity. I've had a chance to read their bios, but I want to kick it off and give them an opportunity to tell their story. In particular, I'm going to start with Dr. Jarrett. And Dr. Jarrett, if you could just kind of share with our audience a little bit about who you are, your background, your passion, and your purpose. And then I will follow that up with Dr. Ansari and Dr. Davis, and then we'll really start a conversation. So to you, Dr. Jarrett.
So thank you so much for this opportunity. So I guess when you dial it all the way back, so I'm a Southern girl. So I grew up in the South in Atlanta, Georgia, only child, and had the opportunity to go to public school, and my parents were involved in the community and did various things through our church, just really had the opportunity. And in particular, my dad was an attorney and he believed in service. So I kind of knew that from a young person. And I got an opportunity to go to college at Brown University in New England. I had my Ohio connection when I went to University of Cincinnati for medical school. And I did my residency in Texas. So after I completed my residency in OB-GYN, I stayed on in Texas for including residency about 20 years. And I had the opportunity to have my own practice, to practice at one of the university systems. And I had the opportunity to be in group practice. While during this journey, I got the opportunity to work with a federally qualified health center, one that was in Dallas. And it was through that I saw that it is such a rewarding feeling to be able to serve, to be able to go into a room with the patient and impact them, this patient-provider relationship. But I also saw that over time, there's the potential to impact just not that patient, but the community. So when, in particular, when you're in community medicine, you can make policies, procedures, you can engage, you can outreach, where you impact not just that individual sitting in front of you, but all those that you serve. And so through that volunteer experience, it got me really thinking about what did I want to do with my life. Now, obviously, I knew I wanted to be a physician. I wanted to be, and I'm an OB-GYN, but what's next? Like, where do I, what legacy am I going to leave? What do I want people to say about me? And so I really found it very rewarding in community medicine. I had an opportunity to become a chief medical officer of a health center in DFW. It was incredibly rewarding. Again, I was able to take the skill sets that I have developed over the years to be able to impact the individuals of the county that we served. So in the midst of that, I had an opportunity to come to Ohio. And, being in Texas for so long in the warm weather, it's like now getting ready to go to a place that snows. I hadn't been in anywhere that snows in quite some time. Last time I saw snow, we had to put it in the freezer so we could make it stay. But so I, it was just this opportunity because in particular, in the health center that I work in now, we're an FQAC. And one of the very interesting things about our health center is that when you look at our history, we kind of started off more in the behavioral health and psychiatry space. So very robust programs for individuals who may be experiencing severe persistent mental illness, all, needing counseling, depression, anxiety, but we really also wanted to make sure that those same individuals had quality health care. Because sometimes when people are having other diagnoses, people get caught in a diagnosis and they forget about that people have diabetes or hypertension or thyroid disease, and they just get caught in this one part. And so often you would have patients that may not get medical problems treated because people just forget about them. They don't feel comfortable with the treatment. And so I saw this as an opportunity to be able to come to Cleveland to bring to the centers and grow the primary care department so that when we have patients that are here, they get holistic care, that there is no stigma, but you can come here and you can get all services. You can get primary care, you can get dental, you can get HIV services. We do needle exchange, we do MAT. So people who have problems with addiction, we also serve. In addition to that, being able to offer behavioral health services and psychiatric services. We even have early learning centers, and we have workforce. We help individuals get employed. So the whole idea is that we are here to serve our community. Anyone who, you can be an individual, you can be a family, any family dynamics you have. So for me, the journey is one of service. You have to just decide, what you want to do with your life. But for me, I find it most rewarding when I serve. That's what I want people to say about me when I'm no longer walking this planet, is that I served well. And so in my current role, we look to make sure that we are looking at the whole person, the family, that we take into account. We live in a world where racism is alive. And so figuring out how we address that and looking through that lens as we care for the people within our community.
Dr. Jarrett, thank you so much for that. Dr. Ansari.
Yes, it is a pleasure to be here and be with my family. Let me just say, I am born and raised in New York, in New York City. I came up to Buffalo, and I've been here all my adult life. All my children, my husband, we have been here over probably 30 years. And let me just say that, much like my colleague, I have a passion for the community. And it's just like I give the analogy of, you have people that are performers and artists, and they know what they are, and nobody can stop them from being who they are.
Yes.
That's the same feeling I have for community life. And I went all through from my elementary school to a PhD in public school. So I'm an advocate for public school and public education. And so if you had asked me that I would be leading a federally qualified health center in Buffalo, I would say that is impossible. That was never my desire. However, our journey in life, we have to take it where it comes. So I have to say that I started the health. I started in the health center in 2006. We started probably with 6,000 patients. We have over 20,000 patients now in 2 different counties, four or five different sites, probably about 17 different languages. So if you had asked some little girl out of New York City if that would be your goal in life, that would have not been mine. However, what I will say is with the work, particularly following my colleague, Dr. Jarrett, talking about the passion in the community, it's the passion in the community. So, and I have to say that I use the analogy I showed my staff the other day, the Funk Brothers. And if those that don't know about the Funk Brothers, they were the musicians of Motown. And those musicians of Motown, they were invisible to the average person. If you asked the average person who was Motown, they would give you the Supremes, they would give you, Stevie Wonder, but the real music was behind the Funk Brothers. They were actual musicians and classical musicians at that. And they couldn't find jobs at that time. But the way I see primary care in our role, we're like the Funk Brothers. We had the beat to the community as primary care, and we have that passion. And I am an advocate of making sure the community get the right sound. And I'm in healthcare. We're trying to get the right rhythms for healthcare.
I told you I got to get them buckle up.
I love it.
Dr. Davis.
That's the kind of health center I work for. So, my name is Kenyani Davis. I'm actually originally from Phoenix, Arizona. I was raised by a single mother. It was myself and my younger brother. I actually lived in Cleveland. So my husband is from Cleveland. Shout out to Cleveland State. And my in-laws and everything are in Cleveland. I was actually trained in Cleveland and in Baltimore. And my mother-in-law is actually a retired public school teacher out of Cleveland. So this is an honor and a pleasure to even have my story. I'm always in awe that anybody wants to hear my story, because I think sometimes when you're a product of your environment, it becomes so normal to you that you don't see not necessarily what's good in it, but what's impactful in it. But like I was saying, I'm from Phoenix, Arizona. I was raised by a single mother. I went on to college actually in Iowa, and like history sometimes repeats itself, I actually became a single mother myself. And part of my story is this juxtaposition of trying to always fight kind of not being a statistic, but then also trying to break through and figure out what is this, how do you navigate in this new world? And this new world for me was medicine. And when you come from where I come from, becoming a physician is one of those things that just really doesn't really happen. And all I could do was dream and say, okay, I want to become a physician, and boom, and then it happened, and you don't know where to go from here. And that's where paths collide. And I met Dr. Ansari, who kind of said, I'm going to invest the time in you and mentor you. And here I am now, the chief medical officer at this federally qualified health center that she started. And when I think about what my mission is the advancement of all people, but especially underrepresented minorities, and giving them platforms and voices through education and through medicine. And as a physician, I really truly believe in the root word of doctor, which is teacher. And that is what I try to bring to my professional life, my clinical life, and my educational life. So that is who I am.
Dr. Davis, Dr. Ansari, and Dr. Jarrett, I cannot thank you enough. I mean this as a husband and also as a father of a baby girl who will always be my baby, who is 7 going on 20.
Okay.
Honest to God, cannot wait until she sees this so she can actually see the amazing work that Black women are doing across this country. And I just want to acknowledge that up front, and we'll get to that in a second. We're talking about Fight for Good, which is an amazing film. And in the opening, we kicked it off by really highlighting this pandemic, the fallout of the pandemic, the crises that we're all facing. So we're in a fight. And I love where you took us, Dr. Davis, about the need to break through. and the need to navigate. So just using the language that you just used about your personal story, which is, I think, something that we can all resonate with because we all have a story to tell.
Yeah, you're right.
And I would love to hear your thoughts. And I'll start off with Dr. Jarrett and hear from Dr. Davis and then Dr. Ansari about the fight that we're in right now with regards to this pandemic, particularly around the health disparities that we're seeing in Cleveland, in Buffalo, and frankly across this country. How did we get here? And how do we break through?
So one of the things that is very interesting about Cleveland, we have a very robust medical community here. We have some very phenomenal medical centers that offer very, very good care. But when you start to look at some of the neighborhoods, you see it's like it's two worlds existing, where you have individuals who are not accessing the care. You try to get to the gist of it. And I think for me, especially moving into the area, I needed to get an understanding of what's happening. How do you have such robust systems, but then we have communities that aren't even a mile away that have some of the lowest vaccination rates and some of the lowest rates of accessing care, when right in their back door are medical facilities that tower in the sky, and some of them are nationally known. Some of these medical centers are internationally known for their excellence. And so, one of the things I had to do is I had to go and start talking to people like, how can we get you to want to come? Like, what are your fears? What are your concerns that you choose not to come in? Is it transportation? Is it the relationships that you may have had or experiences you've had here? Because again, I came into a new area. So I feel like one of our charge with our organization is becoming one with the community. It's easy to sit and think about what we think people need. We say that this should work or that should work, but we're not really asking the people who we're trying to impact. And so we're not sitting down with them. We're not meeting in community events, getting to the grassroots and saying to people, okay, what are some of your barriers? And how can we address that? If the barrier is transportation, okay, how do we do that? Is it fear of you're riding with someone and you're concerned about their vaccine status or if they're going to have a mask? Or if you come in, how's it going to be paid for? There's a lot of, or it could be something as simple as you don't see representation of yourself. You walk into a health center, any place, and you don't see anyone that looks like you. And then people start to think, well, if they don't hire people that look like me, then are they going to give me quality care? So I think there are some things that are just inherent in systems that we really have to talk to people and find out what are the community needs. And I think COVID just exacerbated all of that. I think as you said in the video, a lot of those things just came into place. One of the things that was very helpful for our community health center is that we really leaned into, like many people leaned into, is using telemedicine services, being able to create video, we call them Zoom rooms, where if there are individuals who want to be seen, some of them want to come in the health center, but they're even nervous about sitting in front of someone. We created different spaces for people to access care.
Thank you so much, Dr. Jarrett. Dr. Davis, Dr. Ansari, we're in this fight. How did we get here? And how do we break through?
We didn't, in my opinion, we didn't just arrive here, right? We've been here. It just so happens that people are woke now, right? You can ask anybody from communities that look like ours. We say this isn't new, right? I always like to say that COVID is a health disparity on top of a health inequity. And what that means is disparities can happen by chance. Inequities don't happen by chance. COVID didn't just say, hey, I'm going to hit the Black and brown community hard because they look good. That's not what happened, right? As long as these health inequities that Dr. Jarrett is talking about continue to persist, you will always have things like COVID or swine flu or H1N1 or whatever pandemic, epidemic thing you want to put on top of that. And until you fix the underlying structures, which are those social determinants of health, those social drivers for those inequities, those populations will always be vulnerable. Um, so we didn't just get here, we've been here, right? But through the lens of COVID, people are able to see it in a different way. And now we have to ask ourselves, what is the ask? How are we going to start to fix the root cause or the pathology we like to call in medicine? Or are we going to continue to keep throwing medications at it? Where are we going, from here? And that's, I think, is the exciting part.
I will answer by how do we get through it is to understand language. We always talk about how the barriers and what are some of those barriers, and we know that structural racism is a barrier. But when we actually try to fix it, we're not actually fixing it. We're actually managing the structural racism that we're in. So now what you have to do is understand that the barrier, you got to break the barrier. We think we broke the barrier, but we didn't break the barrier. What we did was manage the barrier. So we have to really be thinking about what Dr. Davis says is that pathology is understanding the pathology and then taking it apart to understand what we're in. So, I think about Dr. David Williams and his work in Harvard and as a sociologist, and talk about racism and COVID and its impact. When he also talks about how in healthcare we die every 7 minutes, African Americans, and Mr. Floyd was murdered in 8 minutes and 46 seconds, but our healthcare system is killing us in 7 minutes. So think about that. So how do we break that? One of the things that COVID has done is it has forced the medical community to listen to the community and listen to the patient, because there was no research for COVID. There were no books to say, let's go back and look this up. We had to listen to what the patient was telling us, what the symptoms were, for us to understand what was going on. So one of the ways to break through is to keep empowering our communities, particularly communities of color, to keep asking questions. Keep pushing into the system, because those of us in the system, we have our own barriers to work through and navigate. But if you push us, we will continue to break through. But we need the pressure from the bottom in order for us to push at the top.
Talking about barriers, in the film, Dr. Ansari, you said something that was extremely powerful. And I'm going to repeat it to you, and I'm going to pose this as a question to all of you. You said that this pandemic exposes who is on the front lines and who provides most of the services, mostly women of color, who also have families and children to take care of. But yet they risk exposure each and every day. When we look at the pandemic, particularly on different genders, in this case, women, can you speak to the impact that the last 18 months have had, particularly on African American women, in terms of some of the stressors that has always existed and how this might have amplified it? And we know when we look at many of our demographics in terms of one of the most powerful forces and blocks is also African American women. So can you, particularly for our audience, I think it's amazing that we're having this panel of three amazing African American women. I wanted to kind of bring that out and say, what are you hearing? What are you seeing? What has been the impact? And what can we do as we think about potential policy solutions to address the inequities that even exist, not just race, but also in gender?
In self-reflecting on that statement, looking in hindsight, we had to find who our creator was, and we had to dig deep to know that we had to sacrifice. I, as a leader, as one of the only Black healthcare leaders in Buffalo, I have to be very grateful and very thankful for the team that I had, because I asked them to come out to war and leave their children and their families in a pandemic of we had not seen in 100 years. I asked young mothers to come out and fight a war that we couldn't see. I didn't shut down the health center. We had to have faith, and we had to do a lot of supporting and empowering each other to come out on the field every single day. And to this day, we still do. So we're warriors. And we're warriors every single day. COVID only just exacerbated and opened it up, because we came out on the field with COVID with no tools, no weapons, no tools, only our God, faith, and the talent that is sitting here with Dr. Jarrett and Dr. Davis as MDs. And I asked her, and she'll tell you the story. She'll tell you that story of how I got her to start thinking about how we're going to treat our community because we're dying disproportionately. And I will turn it over to Dr. Davis to tell that story.
I don't think, is there a censor button for this? Because that's how it went. No, but she's right. I have 3 kids personally. I have a 18-year-old who I just took to college, and I have 2 little girls, a 5 and an 8-year-old, who are actually in Cleveland right now, by the way. But when this hit, there was nothing, right? I mean, it wasn't like you can go to Up to Date or go, read a journal article or anything. It wasn't there. And we had to go old school, and we don't teach our physicians anymore, or our medical students, how to really be physicians, to have independent thought and to pose a question to us and find a solution. So I said, okay, well, I mean, there's one thing I do know how to do. I know how to read. So I, started reading, and I remember I was on the phone with, Dr. A, and I was telling her, I was like, yeah, I don't know what's going on. I was like, but, I'm reading the pathology of this and looking at other stuff that happened, previously, like SARS, that pandemic and whatnot. And I said, I don't know. I think we can possibly kind of decrease viral load by doing some of these different measures at these different points. And at this point, it's a free for all right now because we don't have any evidence-based medicine. And I remember she stopped and she said, do you think it'll work, Dr. Davis? I said, I think so, but I need to go get an IRB approval and do this randomized control trial. And I'm going to put it nicely. She said, what are you doing? Just do it. Put the protocol together. Just do it.
I put a couple of curse words in there.
Yeah. I was trying to make you look good. So she said, just do it. And I mean, here I am, a young physician, and I'm just like, what do you mean? This goes against all of the grain of everything that I was taught. We can't just do that. And she said, our people are dying. And so that's when we kind of put this brilliant think tank together to really pivot to the need of the community. And at that time, we were the preferred organization for the Department of Health, who was sending all uninsured people to us. So here are people that we have to find a way to bring their health literacy up to speed to help and also medically navigate them through this water. So that's always the story. So that was the first time that I learned that, we were at war and we was going to make our own tools.
Dr. Jarrett, is there anything that you would like to add? I mean, this is so powerful in so many ways, and I'm going to summarize some of the key things I'm hearing from this conversation in a few, but Dr. Jarrett, I wanted to turn it over to you.
Just quickly, I think one of the things when I look back, when you go through medical school and you choose your specialty that you want to be in, we accept certain risk. Like if you go to the OR, you accept it. Unfortunately, one time you may get cut, you may get stuck, or something that can happen. But this was a different type of fear. We all had to reach deep inside, because this, like you said, there's no evidence base and there's no uncharted waters. It's nothing to desensitize you. All of a sudden, you're in a situation where there is risk of something. In most cases, you can't even see. You can't see it coming, even though you can take all the precautions, still bad things can happen. And so when I was thinking about myself and our team, just getting ourselves mentally prepared for the day, not knowing what's going to happen, doing our very best and recognizing that in some cases we still may get exposed to COVID, even though we do all the right things. And so it was just keeping ourselves healthy mentally.
So my question to all of you in the time that we have, Dr. Ansari, given the fact that you're absolutely right, there's so much money in the healthcare system, how do we prioritize those who need it the most? And how do we ensure that as we start to create, rebuild, and reimagine our collective futures, that we see more doctors, more healthcare workers, more leaders like you in a lot of these systems?
I think one of the ways we can do that is collectively sit at the table with the insurers, primary care, all of the folks that are all the entities that work, I'm just going to say in this healthcare space, and start talking collaboratively to change. We work in silos, but the policies are made up here that people that don't even never have a clue what happens down here. Mm-hmm. So what we have to do from where we sit is to find our way. They come down, we go up. Somewhere in the middle, we start working together to understand how we make change. Because what COVID has done, it made us realize that no matter what color you are, what race, what ethnicity, at the end of the day, we all may die from this disease because we're all human. And if we don't help those of us that are underserved first, the elite is going to go too. Mm-hmm. Right? We all, so, because the virus doesn't care how much money you have. So the one thing that this disease has done has leveled the playing field, may not be structurally because we couldn't get tests and we couldn't get vaccines in the underserved community to the last minute, but that's a whole nother issue. But what it did make us understand how racism impacts everybody. Mm-hmm. And how structural racism impacts how you will live and die too.
No, I think that's extremely powerful, Dr. Ansari. And again, I will give you credit whenever I use it, because I think that is extremely powerful. And I'll build off of that. As we are thinking about, I've heard so many people say, I can't wait to get back to normal. I can't wait to get back to normal. And I'll tell you, Dr. Jarrett and Dr. Davis, I get so nervous when I hear that. In part because of the fact that I say to myself, for the last 18 months, we've been on timeout. And we have been looking at all of these inequities. To your point, Dr. Davis, COVID did not create any of these disparities. It has only exacerbated and amplified what has long been structural issues. So why are we in a rush to get back to normal?
Right. I'm not.
And I would love to get your thoughts on that as we kind of think about what we have learned and continue to learn. And I agree with you 100%, Dr. Ansari, that we're interdependent. What I do impacts you, what you do impacts me. And COVID has shown us in very simple terms that we're an interdependent society. But how do we get our viewers, our partners, our community leaders, our business leaders to realize that the goal should not be to get back to normal, because normal represented a lot of these disparities that we're talking about? That we have to be bold and courageous and warriors to build something new. How do we do that? You three are the amazing experts, and I saw your reaction, Dr. Sorry.
No, you're so right. Why go back to normal when you can make something new? You know, and the point that I definitely want the viewers to understand is that social determinants of health, or social drivers of medicine, compose and make up 80% of the totality of somebody's health. Only 20% happens in the rooms that myself and Dr. Jarrett sit in. So when you talk about, what I love when people talk about health disparities or health outcomes, they always talk about, well, the doctors need to do this. I'm sorry, by the time you get to my brick and mortar, it's a little too late. Where you have to be focusing on is the built environment, where people live, where they work, where they play. So I want people to look at health in the totality of the lens of what it is, not just in health. So part of it, so when you talk about Buffalo and you talk about Cleveland, mass incarceration, mass incarceration is a public health issue. And Dr. Jarrett can speak to it. I'm an internal medicine physician, but I do a lot in maternal mortality. When you talk about what we call weathering or allostatic load, that toxic stress that gets put on people, especially African American women, that alter their DNA, that allow them to start to have chronic diseases earlier in life, which cut their life a little shorter, which allow them to be on medications a lot longer. All of those things are interconnected, like you said. So the real question is, are we going to continue to put Band-Aids on it? Or are we really going to start to put the emphasis on really what health is? Are we going to start talking to the education system and start saying, hey, we really need to start focusing money? And I talk about it in the documentary. If you really want to fix anything in healthcare, you fix the education system. Because by the time they get into my office and I'm talking about diabetes and I'm talking about hemoglobin A1Cs and all this fancy stuff that makes me look really smart, you have to have at least an 11th grade education. But when I have politicians who are trying to figure out how many prison cells they need, and they're looking at the 3rd to the 5th grade to make that justification, should I really be talking about hemoglobin A1Cs, or should we really be talking about our school systems, our education systems? Because as we educate people and we educate communities, we give them cultural capital. And we give them cultural capital, we allow them to be sustainable and do more things. So that's the new normal that I think we should start to create. And I think that's part of that breakthrough that we were talking about.
Dr. Jarrett, Dr. Ansari, as part of this building new, what would you like to add?
I just think that it's a time to reset. Yes. Like, this is the moment, and within history, there's always been those moments where we have a pause to reset. Not nostalgic of the past and romancing what really probably was not, but really just pausing and saying, okay, this is something that impacts everyone. To Dr. Ansari's point, it doesn't recognize color. It doesn't ethnicity, where you sit in life, where you live. None of that matters. This virus is indiscriminatory. And so really sitting down and saying, where do we want to go as a people, the world? Like, what when people read back in this 100 years from now, we had this pause moment. What did we do? How did we come out of it? How are we better? What did we learn from this? Life is precious. And we see all these people around us being impacted, from children to the elderly. And it's like, when you have that moment, when you have to decide, what do we want it to be? And we have to get out of the past about what it was. This is where we are now. And where do we want to go? Yeah. So I really feel, to your point, I think we need to stop talking about what has happened. This is how life used to be. But now we have an opportunity to do something different. It's a reset.
And I'll just summarize it by saying, it doesn't cost us anything to change our minds. So I will leave it that we don't necessarily have a race problem, we have a mind problem. So when we start to change our minds for the good and have a better vision for ourselves, then our minds will change with the way we will present ourselves with the new normal.
And on that note, Dr. Ansari, Dr. Davis, Dr. Jarrett, thank you so much for your leadership, for your vision, for your courageous actions. You inspire all of us. And for our viewers, I want to thank you for joining us for this amazing conversation. I hope you, like me, took out your notes. I have a lot of notes here. I didn't want to be rude to my panelists. I wanted to start tweeting, because there's a lot of tweetable moments in this conversation. But we do have an opportunity. That opportunity is a reset. That opportunity is to build anew. that opportunity is to change our minds and to really think about where do we go from here? On one hand, we can continue to put Band-Aids on what has been long-standing structural issues. On the other hand, we can be bold and courageous, be warriors, as was discussed today, and really do the hard work of creating something new, something that really takes into account our interdependency and also takes into account our collective humanity. I hope you've enjoyed this amazing conversation. I am deeply honored to have been able to moderate this with these amazing leaders. And I hope you also have a chance to visit us at aarp.org/Black community. Also, another resource for you is www.chcb.net. And then finally, www.thecentersohio.org. 3 amazing resources that you can actually turn to start doing that work, because we all have a responsibility, and we can only get to that new normal by working together, by being intentional, and by being purposeful. Thank you for your time today, and have a good day.